Joining us now is health policy professor Raisa Deber from the University of Toronto. Professor, is $73 billion stretched over 10 years enough to make a significant impact to our healthcare system here in Ontario?
Well, that's a tricky question because this is money that goes basically into provincial general revenue, and the province then decides how they are going to use it. So there are some terms and conditions, but they're relatively moderate ones. So it's not like the exact money is what goes for healthcare. It goes into provincial resources, which the province then uses to cover what it needs to cover. One of the tricky things with healthcare is that they have a lot of focus on what they call the determinants of health, which are not in the healthcare budget. So if people don't have housing, if they don't have food, if they don't have clothing, then they may end up with much higher healthcare costs. If the water is polluted, if the air is polluted. So there's all kinds of things that governments have to do to try to keep people healthy, which are not necessarily going to turn up in a healthcare budget.
Is there anything about this agreement that concerns you, perhaps any gray areas that could be left up to interpretation?
Well, there always are, because one of the problems that we have is under Canada's Constitution, healthcare is a provincial responsibility. So the question becomes, to what extent do you want to have national standards or leave it up to the province? And they're talking about some of the things. I mean, the interesting thing is a couple of provinces just struck a deal to try to make it easier for people, for clinicians who are registered in one province to be able to practice in other ones. Because this has been an ongoing issue, because back in the day, the idea that you could be in one province and deliver care virtually or anything else to another one wasn't part of what people thought about. So what do you do about that? I noticed the deal talks a bit about mental health, because that's a major one. Because back when they set up healthcare, mental health meant being locked up in a provincial psychiatric hospital. And as a result, mental health is one of the things that doesn't have to be covered for the most part. And this become a real problem. So what do you do about that? So I was pleased to see they're at least starting to look at some of the areas that the rules don't cover, but it would be nice if they did.
In your opinion, despite this agreement, where does Ontario's healthcare system lack? In which areas should the province focus?
Well, I think a lot of the gaps, are, as you're seeing, are in some of the determinants of health. But one of the, and you're seeing it in terms of things like some of the wait lists. But, I don't think we want to get into all of the debates about the private sector, but it's, should you really be pulling in for-profit delivery? Where are they going to make the profit from? So either they're going to give worse care or they're going to charge more money for it. So the whole argument about why you want for-profit care, I don't understand, and why Ontario is moving in that direction. Because most of the places that use it find you spending more to get less.
Thanks so much for joining us, Professor.
Oh, thank you.